Bad breath, medically called halitosis, can result from poor dental health habits and may be a sign of other health problems, so it's important to get it checked.
Well, there's a number of origins for halitosis. The first thing that we see is, of course, that it can be an indication of a systemic disease, whether this disease is in the mouth, something like gingivitis or periodontitis, or sometimes oral cancers. Often, of course, also systemic diseases like diabetes can cause this halitosis. And then another thing is, of course, bad lifestyle habits. There's no way that when you're smoking a cigarette that you're going to have a nice fresh breath. And then, of course, the most important thing here is actually an insufficient oral hygiene regime. The point of the oral hygiene regime should be to actually remove bacteria. Bacteria will do two things. It's going to pass gas and it's going to excrete toxins. So it's important to brush the teeth, get the bacteria off, floss the gums, get it out from underneath, and then use something like tongue scrapers or oral rinses to get the cheeks and get the tongue as well, because 85% of the whole cavity and bacteria sticks on these and not on the teeth itself. The technology in toothpaste has actually come a long way, where it started from just being a basic matrix with a lot of fluoride, hoping that it will actually combat tooth decay. A lot of these companies have now developed ways of actually prohibiting this bacteria from sticking to the teeth. Of course, they have substances in there that will actually prohibit bacteria from growing. And this is the essence. It's really to try and either keep the bacteria from the teeth or from the gums, or then removing it sufficiently once it's on top of the tooth.
If you're concerned about possibly having halitosis, visit your dentist for a thorough checkup. Another condition which can cause as much social anxiety as halitosis is excessive sweating. This can result in sweaty palms, sweaty feet, or excessive perspiration under the arms, in the face, or in other areas of the body.
Hyperhidrosis or excessive sweating can occur in one part of the body, for example, just the underarms, the palms, the soles, or we can have a generalized type that occurs over almost all the body. The primary type we usually find in childhood or adolescence. There can be an associated family history. This occurs as a result of a little problem that occurs in the thermoregulatory or the temperature part of the brain, and hence we have increased sweating. Secondary hyperhidrosis can be generalized. We have various causes. We have endocrine causes, for example, thyroid problems, diabetes. We then can have spinal problems. We can have brain tumors, anxiety, certain drugs like antidepressants, excessive caffeine, cardiovascular problems.
The first point of call if you are seeking a solution for excessive sweating is a visit to your GP, who can assess the severity and help you explore different treatments.
Treatments for excessive sweating range from simple ones like airy, comfortable clothes. Then you have more specific treatments. You can use an underarm deodorant or an underarm roll-on that contains aluminium salts. You can also use a specialized type of treatment called iontophoresis, where your hands or your palms, your soles, are immersed in a weak electrolyte solution and a gentle electrical current goes over it. This may not be entirely successful. There's also oral drugs can be used, and then the other famous treatment is your Botox. Remember that it's contraindicated. That means it can't be used in pregnant females and in breastfeeding females. You also need to discuss the side effects of Botox with the doctor doing it.
Botox injections temporarily block the chemical signals from the nerves that stimulate the sweat glands. Without the chemical signal, the production of excessive sweat.
The success rate of Botox is very high. About 90% of our patients after their first treatment are happy with the results, and the rest generally just come for a small top-up where they might have a little patch of sweating still that we maybe didn't cover, but after that top-up then they'll be perfect. The treatment lasts anywhere between 3 to 9 months.
Botox treatments always carry some measure of risk. It's important that the treatment is administered by a qualified professional and that you know the possible side effects.
In South Africa, only registered medical practitioners who are experienced in Botox injections are allowed to perform the treatment, and the public must please be aware of unlicensed unregistered practitioners who perform these treatments with black market products or cures.
Botox isn't a cure for excessive sweating, and treatments are required once every 6 months. You need to consider the cost and feasibility before you choose this route.
Hyperhidrosis or excessive sweating places a big burden on a lot of the patients in a psychological, emotional and social perspective. So these treatments really can change their lives. By not sweating, it just boosts their confidence and they can perform their normal daily functions to their best abilities.